Dr. Torres, let's discuss new techniques that are designed to enhance the viability of lung tissue during transplantation.
Tom, the Achilles tendon in transplantation is availability of organs. In reality, we have so many patients who die waiting for an organ that if we had an increased number of available donors, we would be able to save so many more people. So over the past 10 years, we have been developing technology to try to increase that pool of organs available for us to do transplantation. I'm going to talk about two different technologies available nowadays to help us with that. The first one is the Transmedics, and the Transmedics is kind of a unique technology that it was designed to try to allow us to go farther to harvest organs. For example, I'm in Dallas. If you harvest an organ, you have about 6 hours to get that organ into our institution and hook them up to the patient. Well, imagine if the organ is in Alaska. How do you get it to Dallas on time so that you can use that organ and save a life? Up until now, we would have to say, listen, I cannot make it there, because by the time we go there and bring the organ to Dallas and hook them up, the ischemia time, how long that organ has been out of the donor, is so long that the outcomes would be poor. So the Transmedics technology, what it is a technology that allows you to harvest the organ, you put it into the Transmedic machine, and then you put the organ in the airplane. Now, it can take you 10 hours, 12 hours, and you can bring the organ to your institution, and it's as if the ischemia time had not been but an hour or two. And then you hook up that organ into the recipient, and you have a new lung transplant, an organ that you would never have been able to use because the organ was so far away that it was out of your catch area. So that's the Transmedic. It allows us to go farther away to harvest an organ without compromising the quality of the organ. Another technology, which is what we use in our institution, is what we call the ex vivo technology. The ex vivo is a little bit different. The concept here is when a surgeon goes to the donor organ facility, they look at the organ and they say, yeah, I like what I'm seeing, the organ looks good, let's proceed with transplant. By then, we have all seen the organ, the x-rays, the blood test, etc. But we have not seen the organ. When the surgeons see the organ, at times they say, I know all these tests look good, but I don't like that organ. I do not know, I don't feel confident that that organ is going to work. And if you are in that predicament, you have to turn down that organ. And you cannot take that organ and risk that it doesn't work, and then suddenly the patient dies, the recipient dies. So the ex vivo technology, what it does is it allows us to take the organ, harvest the organ, bring it to our institution, we put it in the ex vivo. Then we can test the organ. How's the compliance? How is the organ, the lungs expanding with a breath and retracting?
How much more time does this give you?
6 hours, 4 to 6 hours. We're at 4 right now, but over time it's going to give us even more time. But in reality, we only need 3 hours to test that organ, to see if the blood supply is working well to that organ, test if the oxygenation of the organ is good. So it allows us to test the organ and say, yep, this organ is going to work, or no, look, we did a chest x-ray now, and look, what looked like it was maybe a problem really is a big problem, and if we had used this organ, it would have failed. So imagine how useful this is now for us, where in the past we would have thrown away the organ, and now we are able to recuperate 40-50% of those organs that we were unsure, and now we can use them on a patient.
Great news. Where time is critical, you have new tools.
Absolutely, and you can see how the future then is brighter. We're using this technology to see if the organ works or not. But now you can imagine, whoa, that organ that does not work, can we fix it? And that's the next step, looking at lung transplantation and the ex vivo technology and how to increase the availability of organs.
Thank you, Dr. Torres. We'll leave it there.
Thank you, Dr.